Welcome back and thanks for staying with us. Tshwane Emergency Medical Services have called on parents and caregivers to ensure that children are always left in the care of an adult and in a safe environment. This comes after 5 children were burned beyond recognition in a shack fire at an informal settlement near Laudium in Pretoria yesterday. Officials say the mothers of these children actually happened to be sisters and allegedly locked the children in the shack and went to a nearby tavern. Let's unpack the story for you now. Bring in Clinical Director at the Teddy Bear Foundation, that's Dr. Shaheda Omar, who joins us via our video link. And Dr. Omar, it's lovely to have you on the program, albeit on this devastating note. Thanks very much for making time. And, sadly, it's an all too familiar story in a country like ours, isn't it? We've heard this kind of tragedy before. I wonder what came up for you this time around when you heard what happened this weekend.
Well, indeed, it's such a tragedy. Just to think, 5 vulnerable children, what must have gone through their minds in the last few seconds and minutes that they went through that ordeal. One again looks at it, at the whole story. It's just a repetition of what has happened in the past. We know in Alex where mother and father went out to the tavern, Kayelicha. There are so many more examples, and yet we find ourselves facing this tragic death of children. And it's, again, one looks at, what propels parents to leave children unsupervised, unattended, and locking them up. The intention is to protect them, but unfortunately, the act resulted in a tragedy. And for me, this just reflects on the attitude of many primary caregivers, parents who lack insight, who lack understanding, to leave children on their own, unsupervised, and not even concerned that if any of the children need anything, there'd be nobody there to their rescue. The inherent or implicit expectation of any child is to be protected by their caregivers, to be protected by adults. So this is not only a tragedy, it's absolutely devastating to see that children are left to their own vices and left without any proper care. It's a violation of the Children's Act. And even if we look at the Constitution, Section 28, which speaks to children being protected, having health care, being safe. And unfortunately, this is a gross, gross violation. It's inexcusable. No lack of understanding or insight can actually justify or condone what has happened to these children.
Well, I suppose you've already answered my next question, but my understanding is that the parents have been arrested, or the mothers who we understand went to that nearby tavern. And I suppose all justice-seeking people will welcome that, right? But I wonder if it goes far enough. I mean, is there something about, what these parents fundamentally, supposedly don't understand that would have led them to doing something like this? In a context where, again, conversations like this happen so often on platforms like this, and yet we're finding parents still making the same mistakes at best.
So you raise something very important. It's the act and the intention. The intention of the mothers locking the shack obviously was to protect their children, and the act was not to harm them. But the lack of insight, lack of understanding, and living in an impoverished community with probably lack of access to any kind of support structures, resources, and they're only human. But if we look at, again, these are systemic challenges. We're looking at young mothers with not one child, more than one child, and close in their age ranges. For me, that also speaks to the lack of knowledge. More awareness raising needs to be done, and I think more work needs to be done in terms of counseling, contraception, antenatal clinics, where many parents or mothers giving birth are actually not prepared or ready or equipped to raise a child. Child rearing just comes along and it goes along as they have children. So again, I think a lot more work needs to be done in relation to that. Because this act of just leaving children and thinking, okay, they need a break, they're exhausted, they need some social outlet, lack of sufficient recreational opportunities, one needs to again address many things that are lacking in communities.
Right.
And the support.
I beg your pardon, sorry there. And I was about to say, perhaps part of the conversation that we also need to have is to what extent the community here has very important questions to answer. I mean, the eldest, we're told, is 7 years old. And in my mind, if something like this is going to happen, you get a sense that it's not the first time. You know, they probably have done it before, and many, or maybe in other instances, it didn't end in this kind of tragedy. If that is the case, there are people, surely, in the company of these mothers who knew that they are mothers and who would have seen that they are at this tavern without their children. And some of them, if not everybody who recognizes, must have looked the other way.
Indeed, and I think that that's the kind of concerns we have, because we find that communities, you know, child protection is everybody's business. It's and children are, you know, it's an implicit expectation that child protection is my business, your business, our business. So again, people who remain silent, and we look at the community members and looking at, you know, an informal settlement where people live within close distance to each other, surely there should be that kind of response where, concerns are raised and that it's addressed. And I think it's important that the community understand if there's any suspicion or doubt or inkling that a child is being neglected, or children in this case being neglected, that constitutes child abuse, and it is an expectation that it should be reported. Failure to report it constitutes a criminal offense, and people can report it anonymously. So I think if we look at the community as well, look at the social network structure, people who remain silent, and, being complicit, being silent means being complicit. So again, this is definitely a grave concern where we need to empower every person in our societies where there is this look out and protection of children.
Yeah. The point of our correctional services in this country is to rehabilitate those who find themselves in that system. I wonder what you reckon that looks like for these mothers who at some stage, I imagine, will have to be reintegrated into that society.
So, one can only speculate what's been going on in the lives of these mothers. And, this is gross negligence. And we're not saying it was purposeful abuse, not purposeful neglect, situational neglect. But surely leaving children is something that one cannot justify. So young as 1, and the oldest 7 years old, and 5 children. So, of course, the ethos of the Children's Act looks at preservation of the family, but in this case, I think they're going to have a lot of issues to deal with, and certainly would require long-term intervention in terms of the grief and survivor guilt and all sorts of other emotions. So I think that's a fate worse than death for them as well.
Yeah. Ideally, we'd want to intervene before something like this happens. Are we giving that aspect of the conversation enough attention? Being able to identify, for instance, mothers who may be overburdened with their children and who run the risk of potentially neglecting them inadvertently because, frankly, they're human and they need a break.
Indeed, and that was my immediate thought when I read the news bulletin around mothers, the lack of resources, the lack of support structures, lack of opportunities, and this is where, as a community, more opportunities need to be created in terms of awareness raising, in terms of access and availability to support structures. So your healthcare facilities, your faith-based organizations, your other community-based organizations all have a role to play. And I think this is a collective effort and a collective responsibility of communities where each and everyone needs to look out for every child out there.
Yeah. Dr. Omar, while we have you on the line, we're also reflecting this morning on the devastating news coming out of parts of Gauteng where we're seeing an uptick in incidents of suicide or attempted suicides. And in some ways, these things are really connected, right? I can imagine a scenario where even these mothers might find themselves contemplating whether their lives are worth living. In the line of work
Indeed.
that you do you reckon that we're any closer to understanding how to prevent something like that from happening? Being able to support people while there's time?
Well, you raised something so important. Of course, prevention is key, prevention is critical, and a lot more effort, funding and drives and campaigns need to be focusing on prevention, working with little children right up to adults, working with everybody on different levels in looking at preventative measures, but having these community dialogues as well. A lot of emphasis is placed on gender-based violence and femicide, and a lot of dialogues are being engaged within community structures. So this is an aspect that has to be integrated and is an integral part of each, and should be an integral part of each and every community, to avoid this kind of disasters and tragedies that we are currently faced with.
Absolutely. Dr. Shaheda Omar, always great speaking to you. Hopefully we don't have a conversation like this again.